Hello, everyone. Welcome to PCE Final Frontier Podcast. I am Shivangi, your PCE guide at PCE Final Frontier, helping one student at a time. Visit our website www.pceff.com to enroll in our courses today. Welcome to the PCE Final Frontier Mnemonic Podcast episode. Today, we are diving into a simple yet effective mnemonic to help you diagnose and treat a facet joint restriction. It gets a little tricky if you are a skilled clinician or a student refining your skills. This mnemonic will help you for a quick recall. So, facet joint restrictions can be sometimes tricky to identify, right? We've all been through those patients, those scenarios where we get a little bit confused and need a minute or two to think about. But this mnemonic will make it easy for us. The mnemonic is UFO, just like a UFO, an unidentified flying object. But in our case, it stands for something very familiar in our practice. Let me break it down for you. U stands for PA glides at the upper vertebra. When you are assessing, start by identifying the restricted segment. Perform PA glides at the upper vertebra of the suspected segment to mobilize and improve movement. F stands for flexion restriction. Often when patients present with facet joint dysfunction, you will notice that they struggle with flexion. Keep this in mind during your movement assessment. It's a key clue. O. The O stands for opposite and opening restrictions. This is the game changer. The restriction is typically on the opposite side of the pain, and it corresponds to an opening restriction, meaning the facet joint on the opposite side isn't opening as it should. So, for example, if a patient has pain on the right side, assess the left side for an opening restriction. And another tip is the reverse applies for a closing restriction. So, if a patient has pain with extension and side bending, the restriction will be on the same side as the pain, indicating a closing dysfunction. So this UFO mnemonic is not only easy to remember, but it also guides your clinical reasoning step by step. You can use it to structure your assessments and treatment strategies effectively. That's all for today's episode. Remember, diagnosing and treating facet joint restriction doesn't have to feel like you're searching for an alien spaceship. So with UFO mnemonic, you have a reliable tool at your disposal. If you found this helpful, please share with your coworkers and subscribe to PCE Final Frontier Podcast on Apple, Spotify, and YouTube. Until next time, keep learning, keep growing. Thank you for joining today. Reach out to us at support@pceff.com for any questions. Follow us on social media on Facebook, Instagram, and YouTube for more content. Have a wonderful week and keep learning.